Okay, our next item number 2, discussion and action on measures to mitigate the impacts of COVID-19 coronavirus pandemic. And tonight I have the great privilege of inviting 3 very important people in our community representing Adventist Rite Out Hospital. With us tonight are the President, Rick Rawson, the Patient Care Executive, Cindy Gordon, and the Emergency Department Director, who I noticed we misrepresented your name, and I apologize for that, is Dr. Kamara Graham. But we'll get started with President Rawson, please, if you don't mind.
This evening. What we want to do this evening is share with you where we're at today as we deal as a community with the impact of COVID-19. And I want to thank you for the opportunity to come to the city of Yuba City to share with that, and also the introduction of Cindy Gordon, our patient care executive, who has done an unbelievable job standing up our emergency incident command system in March. Those intensity of those processes are not set up to go for 9 months. They're set up to go for days. Yet we've kept the intensity in our organization over the entire period from March of this year till now. And as we see the impact of this hitting our communities more than ever. And Dr. Kamara Graham, who, when she took this job of director of our emergency department, I don't think ever realized what was coming, as did any of us. But I thank God every day that she's in that position because the teamwork has been extraordinary. And she can speak to it from a physician's perspective of what we're seeing. And we want to make sure we're available to answer any questions that you may have. But most of all, in my position, it's a blessing to represent the 2,300 or so healthcare workers that show up every day under challenging and difficult circumstances to continue to care for our community, even at risk to themselves. I'm humbled by that. I'm honored by that. And most of all, we want the community to understand that we aren't just here to serve the community, we are the community. Our people live here. It's hard to go anywhere in this town without running into somebody who works at Rite Out, is a neighbor to somebody that works at Rite Out, has a family member that works at Rite Out, and it's just an honor to be integral into the community that we serve. COVID-19 has definitely been probably the biggest challenge in healthcare in my lifetime, and has impacted our community in every conceivable way. It has impacted our healthcare system, it has impacted our economy, and impacted all of our lives in ways that we could not have foreseen. And as I stand here today, Yuba and Sutter counties are the hot spot, not just in California, but in the nation. And we are seeing that in our hospital. And one of the things this has exposed from my perspective is the fact that in the healthcare industry, we've created a myth. And that myth is, you can do whatever you want, and when things go good, we're really good at fixing you. And I think that myth now has exploded, because the fact is the rift we've seen in the healthcare delivery system between what we do and what public health does has been exposed. Because the health of the public is all of our responsibility. And I think we've chosen the path to be as transparent as we possibly can with the capacity challenges and the issues we have, because there is no way through this without engaging every single member of our community. When people show up in our building, oftentimes, then the reason you see videos of stressed out healthcare workers, and Dr. Graham can speak more to this, there's just a limited amount we can do. We do the best we can to help people through as their bodies fight this off. And that is challenging for a profession that's used to being able to fix things. And what we realize is that the impact on our community is really all of our responsibility, our shared responsibility. And we want people to understand that we are here as a community. We are a deeply connected community. And I think that has shown itself out in the last month. What we're seeing right now in our community is extraordinary spread. We began to see this in early to mid-October. At that time, we had between 10 and 15 COVID patients in our hospital. And we were alarmed because 2 weeks before that, we had 2 COVID patients in our hospital, and we had 33 patients sitting in our emergency department waiting for beds. And we began to think to ourselves, what if we had 40 patients? What if we had 50 COVID patients? What kind of situation are we going to be in? And when we first heard from public health, the rapid day-over-day increases in COVID cases, with Thanksgiving coming, we had a idea of what was coming. We had no idea how fast that would happen and how fast that would impact our hospital. We were as prepared as we can be. And today we have 62 COVID patients in our hospital. This afternoon, we had 16 patients in our emergency department waiting for beds. And it's, as I explained to people, it's dynamic how our capacity works, because every day we have 40 or so patients that come into the hospital and 40 that go out. 2 days of 40 coming in and 25 going out, and we have capacity issues. We can be in a crisis, and 16 hours later, it can be all different. So it's a very dynamic situation. But we work with our entire region, and Dr. Graham can speak to that a little bit more in terms of how we make sure that we can get people where they can get the best care possible. Early in this crisis, we saw a period of time where fewer people were coming into our hospital. We would see an average of about 200 patients in our emergency room a day. In a period of March and April, that dropped down to 100. We knew that maybe 20 or 30 didn't necessarily need to be there, but where were the others? And what we began to see when they started coming back was they were coming back sicker. We had more heart attacks in a period of a few weeks than we would normally see in a few months. And we don't want to see that again. And so we've tried to keep a message out there for people to come in and get care. Yes, we may have issues around capacity, but the professional and the focus on the well-being of our patients and our community is there. And we're connected with an entire region of providers to get people where there is capacity to care for them even when we're impacted. And likewise, when others are impacted and we have capacity, we share that through the entire region, working closely with EMS and all of that. What's made the last few weeks particularly challenging is that because our employees live in the community, they're also not exempt from the spread in the community. Today we have over 100 of our employees out, either COVID positive or else under quarantine because of exposure. That's a significant impact on our workforce. In March and April, we developed surge plans that we could double our physical capacity, take care of twice the number of patients. But that's contingent on the ability to staff those beds. And because this whole surge has hit the nation all at the same time, and you see this happening across the country, bringing traveler nurses and other things we do to manage surge capacity is not an option. And so Cindy will talk a little bit about what we're doing around workforce management and many of the creative ways we have been able to find and bring supplemental staff. But what I want the community to understand is the resources are limited. And, what we've seen in the last 15 days is the mortality of what we've been seeing in the last 15 days is equal to what we saw year to date before December 1. This is having more of an impact in nursing homes than it's had before. But this is a significant change for us, and it's a challenge. Our workforce is tired, they're exhausted, but they keep coming to work because of their commitment to their community and their commitment to their patients. and I couldn't be more proud of that. What we ask the community is do your part as well. Help us manage this situation. Social distancing, wearing masks, these are ways that we can all impact and prevent COVID continuing to spread in our community. So these are challenging times, and as I said, we have staffing issues and we look for ways to do that. Now, we've rolled out a lot of ways to do that. We had a conversation with Sutter today. Is there a way we can use some of their capacity in their surgical hospital? We started innovation for Adventist Health called the Adventist Health Hospital at Home, where we're actually doing acute care in people's homes now. And I heard just this evening, we just started this week. We have 5 patients now in our hospital at home. All this helps decant the capacity issues in the physical space. And the more we can find ways to do that, the more we share capacity throughout the region, the better we're going to be able to deal with that. We knew Thanksgiving gatherings were going to have an impact, and we have seen that in the last week or two. We know Christmas is coming, and we fully expect that we are not at our peak yet. We're at 60 today. We believe we could see hospitalizations in our hospital as high as 80, or even higher than that. And again, it all really depends on how we as a community come together and impact this situation. I have a lot of confidence in our community. I have confidence in the seriousness that people are taking this. And I think the more that we can reinforce that and also share the responsibility, we can do our part and we will do our part. The competence, the skill level, the expertise, we're doing everything we can to create the capacity that we can to serve this community. But it takes everybody. It takes what we do in our businesses. It takes what we do in our private lives. This is a community-wide effort to manage this. So I want to share that as a start off, and I'd like Cindy to come up now and talk a little bit about things from her perspective. Again, like I said, she's run our incident command. I get to sound like I know what I'm talking about. She really knows what she's talking about. So I'd like to introduce Cindy Gordon. Thank you.
Thank you, Rick. It's always great to follow you. Such a great speaker. So I'm Cindy Gordon. I'm the patient care executive at Adventist Health and Rite Out. Been a nurse since 1980. Hope I never see another pandemic. And I just wanted to echo a little something that Rick said. The community is really now the first responders in our fight against the pandemic. So just a little bit of a shift in thinking there. So just a typical day during the pandemic. We start out with incident command debrief at 8 o'clock. We go through the current census in the house, our COVID patients. We make sure we've got adequate supplies, which we are blessed with those. We talk about our staffing. We talk about the initiatives that are tied to COVID, because not only is it caring for COVID itself, there are state mandated testing that we will need to do for our employees once a week in the COVID units. And there is the vaccines that are arriving any day, and how we distribute and track and plan for all of those. Those are not easy tasks during normal times, but with the workforce that you need to expand and the workforce that's shrinking, you can see how there is a great deal of stress in the organization. So we start that, and then we talk about it with a bigger group. And then today, for example, one of the nurses that is one of the lead nurses in our skilled nursing facility just came in and said, I'm just so tired. I'm so tired. And she said, I had to talk to a family whose loved one passed away. And she kind of choked up. And the emotion is so powerful, because not only are we looking at a disease that we can't predict what's going to happen each day, what we're going to see when we walk in the door, we're also physically tired, as many people are working extra hard during this time. And then you've got the social challenges of schools opening, schools closing, that uncertainty. And then just the real the real impact of the loss of the traditional social gatherings that we've all come to know. So those are all part of the stress that you feel. And then when you walk up on the floors, like on our COVID unit, normally what you see down that hallway is people bustling in and out. What you see now is carts lined up with PPE, and you see doors closed, and you don't see anybody because they're all in their rooms with the patients. So a very eerie, different dynamic. The equipment that they have to wear, it's physically challenging. We get to wear masks that you can breathe through. They're wearing N95s or PAPRs and equipment around their waist to go in, and they're having somebody watch them put that equipment on and take it off so they don't go home and spread COVID to their families. So there is that added responsibility for themselves, their care workers, and their families. So you go down the hallway, and then you go to the next floor, and you're usually just really chipper, bright, shiny charge nurse. Looks like her eyes are bloodshot, and you say, so what's going on today? And she goes, well, I came in at 3 this morning, and I'm tired. And I said, okay, I listened to her, and she talked, and she said, it's just hard because we can't help some of these patients. And the COVID population is so, Dr. Graham can talk about this, it's so dynamic. I mean, somebody can be looking pretty good and talking to you and saturating well, and all of a sudden they're really sick and they may need to go to the ICU. So those are some of the challenges that we're facing, but we have such a great team that works together. We communicate with the county, we communicate with the emergency department to work on providing care to the community. And all of our staff know that what we're doing is for our community. We want to keep our ED open so that it can take care of the patients that need emergent care, and that's what we're doing. And we're doing it, I think we're doing it really well, actually, considering the circumstances. So what we do for capacity management is our great physicians come in early. They come in earlier than they ever have to see what potential discharges there are. Our case management team works diligently to make sure that we can move patients to the right level of care. And again, that's challenging. Today, I think we have 16 patients that need a skilled or assisted living placement. And because of COVID, they have restricted access. They're not able to take full capacity. So they aren't able to leave the hospital. So that's something that's more difficult. And then, as Rick was saying, these patients that we get with COVID, they have a longer length of stay because they're pretty sick if they get hospitalized. They're there for a really good reason. And if they're in the intensive care unit and they have to get on a breathing tube and a ventilator, they're going to be there for weeks. And normally, our beds, the normal length of stay is, about 3.5 days in the hospital. And in the ICU, it's about 4 days. And then they move to other places in the hospital. So again, that shrinks our capacity, the beds that we can turn, over to take care of the rest of the community. So that one of the things we've done is, like Rick alluded to, is the hospital at home was a brilliant idea where people, like my dad, said, I'm not going to the hospital if your mother can't go with me. And I don't know, there may be other people out there, but he's definitely one of those. And for people that know that there is an option, if they did have to be hospitalized and that was an option, that may have people seek care that were afraid because they can't have their loved ones. So that's been a challenge for us and for the families. It's a cause of really moral distress and on both sides when we can't allow family members in except, under certain situations. And it's really tough on the family. So a lot of talk about that in the hospital, of course. So we work on the discharges. We are working on the staffing end as well. You can imagine with 100 employees out, that's difficult to recover from. So we are working with the schools of nursing, and there's an emergency proclamation passed by the BRN that they have granted first semester nursing students the equivalency of a certified nursing assistant, which is somebody that helps the nurse at the bedside with the bathing, the daily activities, can help walk the patients, those really important things that a really busy nurse that, if we're short, can help out a lot. So I think the last time that I looked, we were up to 18 offers that we had made. The students are thrilled to be able to come in and help, and we're equally thrilled to have that partnership with them. So that's one of the creative things we're doing. We're also looking at team nursing, which is something that you can do when you have a nurse that floats in from another department that buddies up with a regular nurse there and kind of is their mentor for that shift. So we're doing some work around that, and that's one of the models that we may use. So really just using every tool we have in our armamentarium, I think that's the right way to say that, to keep the hospital open for the community. And I think that the message that I would like to send to the community is that you have a really great hospital. We're making it better all the time, and that supporting the staff by the things that I know are going to be happening in the next couple of days. The show of support from the community is really important to them. They appreciate it, and that the best thing to help us out is to do the things that Rick said and stay safe in the community. So we are your last responder in COVID, and the community is the first. So I'll turn it over to Dr. Graham.
Good evening. Thank you so much for having me. As you can imagine, the last 11 months or so have been a little bit of a whirlwind in the emergency department, to say the least. We started about this time last year hearing first of the virus being in other places and kind of thinking, oh, well, what if that happens to come here? By March, we were seeing New York kind of get decimated. And at that point, we were starting to see some of our first cases. And at that point, it was really flying blind. It was figuring out, what is this? What do we need to do for these patients? What is any, if of the medical advice that we can get? But also, how do we keep each other safe? PAPRs were something that you used occasionally with a TB patient, but it wasn't something you put on multiple times a day. It also wasn't something that we had many of, because you usually had maybe 1 or 2 patients at a time in the whole hospital. So we learned a lot in the beginning about PPE, about keeping each other safe, about how to just reorganize how we run a cardiac arrest. Who needs to be in the room? How do we get to patients and give them the care they need? We were very fortunate that in that first wave, we did okay. And 2 of my physicians were selfless enough to go one to New York to work in their COVID ICU, and then another one actually went to Italy and worked in a COVID tent. So they brought back a lot of information that was really helpful on how do we get to these patients, what is working, what's not working, and where do we go from there. The staff, all of our our advanced providers have been extremely flexible, and they're currently trying to see patients in places they've never had to see a patient before. When that volume dropped, we all were worried. We know that these patients are out there. We knew that they were sitting at home, some of them with, an appendicitis that came because it's now burst instead of us getting to take it out earlier. And we were worried about where those people were, as Rick said. As our volume has increased, and now as we are really starting to see that big surge of COVID patients, our capacity at the hospital has been what we've tried to work through the most. We are still seeing 170 to 200 patients a day through the emergency department. And we have 44 beds. When we're holding 18 to 25 patients, that limits our ability to just get patients in a place where I can push on their belly, where we can talk about things. Along with that, the visitor restrictions, which we absolutely have to do in order to protect everyone, makes it very hard when you're trying to make end-of-life decisions or difficult decisions and you're not able to hold the wife's hand. You're not able to talk them through that situation. And so I think the amount of flexibility that they've had over the last several months has been truly amazing. Right now, we are doing a lot in the emergency department to try and see as many patients as we possibly can and continue to keep people moving. We have hallway beds, which we've always kind of utilized, but we've also started to use every square foot that we can. We've turned places that previously had not been patient care areas into patient care areas, and we are trying to separate people to try and limit exposures. And everyone has kind of changed all of their roles over the last few months. We are currently struggling with having a significant number of COVID patients. And so we do everything we can to separate everybody. But like Cindy had alluded to, these patients get very sick very quickly. And one of the phenomena that had been discussed in New York City was that the patients themselves don't often notice how sick they are. So their family member will come home and say, "You look bad, you need to go to the hospital," and they will be breathing 30 times a minute and hypoxic, and they won't really themselves realize it. And so a lot of patients, by the time they come to us, are fairly sick. It also then makes that decision of who can go home safely and who can't very difficult. I think from our departments, we're in the same boat. Everyone's a little bit exhausted. But some of the best things that I think we've gotten out of this pandemic is our ability to work together in the emergency department, but also throughout the hospital. The relationships that we have with the admitting physicians and the consultants, but also all of the hospitals around us. Typically, pre-COVID, if we were going to transfer a patient, it was because they needed a specialist. It was that they needed a very special neurosurgeon or ENT, something that we didn't have. And now the decision every time we admit a patient is there somewhere else maybe we should think about? And that's not always an easy task. Often it takes 7 or 8 phone calls by the physician talking to different facilities to see if we can get a patient moved out. But we've had great relationships with several of the other hospitals that can take lower acuity patients. They may not be able to take an ICU patient, but they could take a cellulitis. And they've been very, very caring and understanding, and have been communicating with us very closely. The issue we see, especially now, as we've moved into the more restrictive tier and had the shutdown, is that it's not just us. We are a hot spot. We do have a lot of cases, but at this point, you are now calling hospitals and they're saying, "We don't have any beds either. We can't accept transfers. We've got holds in our emergency department." And so there comes a point where not everything can just be transferred out. And ultimately, we want them to be close if we can. If they do have to make one of those life-changing decisions, we want to be able to keep them in our community where they can be with family. So there's been a lot of change. We absolutely want to thank the community that has sent so much love and outreach and gifts and thoughts and prayers. It's been wonderful, but also thank them for their patience because we are learning every single day, and we will continue to learn. I think from the emergency department, in terms of what our ask is from the community, is to please, please socially distance, wear your mask. One of the things, as Cindy had talked about, is that the vaccine is coming. We're working on procedures to get it out for our healthcare workers that are seeing these COVID patients. But as this comes out, if you have questions, ask. We've got a lot of information on the vaccines. We have stayed very up to date on these. We are always happy. If you've got questions about them, ask us. That is what we're here for. We are part of the community, and we want to make sure that we are giving everyone as much information as possible. So just let us know. Otherwise, I think we'll take any questions.
Thank you so much. I'm going to turn it over to the council for some questions. I'm not sure who's going to be the one that answers, but hopefully maybe all 3 of you if they come. Before I do that, though, I just need to follow up and acknowledge the work of you and your staff. I think a lot of it goes unnoticed. Some of it does go noticed, but know that we know you're working hard, and we know that you have the community's best interest at heart. And we'll go ahead and, if you will, field some questions from the council. We'll start with Vice Mayor, please.
Thank you, Mr. Mayor. First of all, thank you guys for being here, as the mayor said. And one of the things in these chambers, we often get to see our heroes here. And those are most oftentimes referred to as our first responders with PD and fire. And but you guys are heroes in this community. And I just want to say thank you. I've heard the stories. I've got friends who are nurses, doctors. I've sat down with spouses that's lost their loved one in your hospital. I know you guys are doing everything you can. And from one council person as the vice mayor, I just want to say thank you for everything you're doing. So I do have some questions, though. And Rick, thank you for being here. Thank you for all three of you being here. You did a great job with the chamber a few days ago, as I've shared. The community has heard for 11 months, wear a mask, social distance, wash your hands, to where I don't think there's anyone out there that doesn't know the general rules. My concern, and I've brought this up with Dr. Liu multiple times now, is we know what those variables are, but what are we doing to take care of our community, and what can we do as electeds to help? Because my concern is the capacity of our hospital. And when we start getting into diversion, and, you know, I understand that, and I don't know what the count is or anything, but over the course of time, we've taken others in and we've sent others out. Do we have people from outside of our region that's been sent here that's impacting our capacity? And what is our real capacity to take more people in? I know you've gone to the home health care, and kudos for you. Whoever thought that up, ingenious, because you're thinking outside of the box. But really, what is our capacity would be my first question, with what we have with our residents. Not saying the others aren't important, but I'm just trying to figure out if half of our hospital is taken up by people that we've taken in, or is it 10%? A WAG, a simple guess, would work.
Yeah, so I'm not aware of any patients in our hospital right now that have not come from out of our community.
So they're all from our
That happened early on when we had capacity, when San Joaquin County was getting hit pretty hard. It kind of went in a wave this summer. So it started in Southern California, came up through Central California, and probably got to us mid-July to August. Back in that period, we got transfers in. We were able to help out a little bit. After the fires in Napa County, we got a few patients from, mainly cardiac surgery patients, and others from St. Helena Hospital, which just reopened this last week. But that has not been in a little while. Furthermore, they've been able to take patients from us now that they've reopened. So we're not taking up any capacity in our hospital right now from patients from other areas. If anything, our community is generating more need than we have the capacity to take care of, and I would say we're mainly out migrating at this point in time. So yeah, that's certainly a question that comes up. There's another related question that relates to surgery, and I was asked this question on Friday: are we canceling elective surgeries? And the answer then was, we're looking at it day to day. As of Monday, the answer to that question changed to yes, and it's mainly because we don't have enough staff to take care of the patients that are being admitted to the hospital. And so what Cindy's team has done is we've shut down as much of the elective surgery as we could, and we're deploying the nurses who would normally work in surgery and PACU up to the floors to support the floor nurses in taking care of those patients. That's never easy. It inconveniences patients that have had surgery scheduled and the surgeons who are wanting to do the surgery. But the fact is, we have to prioritize, and we have to prioritize taking care of the patients that are here. Many of those surgeries can be done at another time, and as I said, this can be very dynamic. But as of right now, all elective surgeries we're canceling, and mainly because we need the workforce. Many of those are outpatient, wouldn't take up inpatient beds. They come in, they go out. But right now we need the staff. So we're open to do surgery on cardiac surgeries. Our trauma department stays open. Emergency surgeries that come in the ED we're available for, but for those planned elective surgeries, we're putting those off for the time being till we see a change in this situation.
And along those lines, Rick, if I can just reiterate, because you mentioned this on Friday as well, is that's elective. If someone comes in and they have to have open heart surgery because it's an emergency, those people are getting taken care of.
Oh, yeah, absolutely. Yeah. So we
It's
have
just
the
the
surgeons, the cardiologists, the teams, the on-call teams, the trauma teams. We haven't changed that at all. Our capacity to take care of emergencies is unchanged. And we will take care of every emergency that comes in. It's much safer for people to come in and let us do what we can for them than it would be for them to drive farther distances, especially for strokes, heart attacks, and things like that. So I'll let Dr. Graham address this because I think it's an important issue because I think people here, and I think this is what happened this spring. You know, I don't want to go to the emergency department because I might get COVID or they're full or whatever reason. And I think there's really detrimental impacts to that. So I'll let you kind of address that.
So one of, I think, the biggest pride of emergency medicine physicians is that we take care of anyone that walks through the door. We don't ever have to ask them what their insurance is or if they can pay. We take care of people. I think that is more important in a place like Right Out because there aren't a lot of close hospitals that can do trauma, that can do stroke, that can do heart attacks the way that we do. And so when you talk about diversion, that's something we've talked about frequently is we can't go on diversion. That would be such a disservice to our community. And so what we have done, though, is very much staffed up the emergency department. We've had a lot of traveling nurses when we can get them. A lot of them are emergency department nurses because we can move and flex a lot easier in the emergency department to move to one area or to another to accommodate someone who is very sick. But there are things that we have good protocols for. If you're having a stroke and absolutely we can't see you, it's still safer to come and get that medication that you need, and then we can get you somewhere. It's safer for us to stabilize your airway, to make sure that you're not actually having a heart attack before you drive that hour to Sacramento or to Roseville. And so I think that's an important thing to know is the emergency department has been able to accommodate all of that, and we continue to be able to do that. It's just a little bit of some puzzle pieces every once in a while. But we're open and we will take care of all patients.
And I appreciate you answering that because I've heard that through the community. The reason our hospital is full is because we've taken so many from others. And so, you know, the community needs to know. And that's a lot of what tonight is about is so they understand our current situation and what happens. And, you know, leading into a next question, if I can continue, Mr. Mayor, I have like 4 or 5.
Make sure everybody gets a chance, Dave.
Okay, I will. If I can get 5 minutes from everyone, I'll at least get an hour here. No, it's the other question you hear is, you know, you talk about the emergency rooms. And I know that in years past, people use emergency rooms as urgent care. You know, people will go in for a cold, people will go in for a sniffle. Has that decreased any at all, or is that still?
I think it's hard. So there's something called the Prudent Layperson Act, which is what allows us to continue to see patients because without being a healthcare professional, telling whether that chest pain is reflux and you need to take a Tums or if you're having a heart attack can be very difficult. I think we've seen definitely a decrease in our pediatric population because there's no school. So they're not getting as much of the regular cold. There's also no sports. So we're not seeing as many of the broken arms and things like that. I think we still do see, I think some of that volume has been replaced with COVID concerns. And people who want to know what do they need to do? I was exposed. Do I need to be tested? Do I need to quarantine? Do I have to call my work? So I think the volume has stayed about the same. last month, we were about 11% lower than our typical November. So definitely volume is still on the lower side. We see most of those so far have been pediatric and some of our minor complaints. But we've also seen a pretty big uptick in patients just there because they need to get tested. But we also did just open our urgent care. So we do have another place for patients to go where they can be seen and be seen quickly, and then very easily transferred into our hospital if they need to.
Correct, and that's down on Bow Grove, correct?
Mm-hmm.
Okay,
Correct.
I appreciate that. I'll just leave with this final comment. I was joking, Mr. Mayor, but they know me too well. No, I would just ask if there's anything that we can do as a city to help you. Please reach out and ask, because our community is why we're here, is why you're here. And we want to stand with you guys and do anything we can to help our community.
Thank you so much.
Sean?
No questions, other than I just want to express appreciation for all the work you folks are doing and everybody who works with you. It's so appreciated and comforting to hear the information that you provided tonight. Really appreciate it, and doing the best. There's no way we can, but doing the best to understand the plight that you go through, and then the stress and the hardship and the sacrifice, and we really appreciate that. It was mentioned, Doctor, you mentioned that too, if there's anybody had a question to ask you, is there a preferred method that we reach you? And what would that be?
I think we can go through there's a line that they can ask questions. I know I get stuff from.
Linda's waving her hand.
Call you, Linda? All right. I'm just going to call Linda.
But we're also we're also very happy if there's particular groups in the community that have questions, that want to have one of us come and speak and answer questions. We are more than happy to, and we can come and answer more specific questions. We, can do outreach. We're happy to come virtually, set up virtual meetings for groups if they need to.
That's great. Thank you so much.
Councilwoman Espindola, questions?
Hey, can you hear me?
Yes.
Good. Thank you, Mayor and Vice Mayor. And Sean, Councilman Harris, I'm getting used to your new title. Very, very well said in the manner of the question and how the seriousness of the issue. Dr. Graham, you and I were on a panel together, and I haven't had a chance to reconnect with you.
Yes, we were.
And unfortunately, I'm in virtual land for reasons of COVID. Cindy, I get your emails, and we haven't been able to connect, I think because of COVID. I guess the question, some of the things that the community always seems to ask, number one, on the issue of why, and I'm not trying to ask you, but just the health and science of it, why is it required to wear a mask? Why is it so important to wear a mask?
That's a great question. So I think a lot of the misinformation that's gone around is that the mask is protecting me. And while recently, actually within the last month, there was a study that came out that showed that the mask actually did provide some protection to the mask wearer, that's not the reason why we wear masks. The reason is that a significant amount of patients who have COVID are asymptomatic, but they also have a high enough viral load that they can infect others. And the mask keeps you from spreading that to others. And so the way I've described it before is wearing your mask is showing your community that you care about them. You may not know who next to you in the grocery store is on chemo or has lung conditions. And so wearing your mask is saying, I care about you. It is some benefit, the regular mask to the mask wearer, which we know now, and that is great. But the masks are to limit the spread of COVID-19. And so it is kind of the ultimate act of love for your community is to wear your mask.
And do you see that people in ER are coming in? I know that you probably provide masks, but are questions of that asked to the patients? You know, were you wearing your mask? Were you socially distancing? Where did you anticipate or think you became infected? Because one of the things that we've seen change over the months is initially, the conversation was not going out and shopping or going to restaurants. And now the spread seems, at least from what Dr. Liu and other health officers, social gathering situations. Does the hospital, do you have any data in reference to how the majority of the patients coming into the hospital are being infected?
So most of the actual data is collected by public health when they do their contact tracing. So all of kind of the official data is what public health has, because they go into a lot more depth than we typically do in the emergency department. What we're trying to figure out is, are you safe to go home, or do you need to be admitted, or do you need something in between? From personal experience, the majority of the people come right out, and that's their first line is, I made a mistake. I went to a baby shower, I went to a wedding, I went to Thanksgiving, and now I'm terrified. And the majority of cases that we're seeing, we'll see several patients from the same family admitted at the same time because they had a large gathering. So that's been a significant amount of the spread that we've seen.
And so those spreads, do you think that people just become, like all of us, the wear and tear of time and keeping up with wearing the mask and the social distancing, it can be challenging for everyday behavior?
Completely. It's, the COVID fatigue is real. It's something we all desperately miss, seeing our family. We all miss this time of year. It doesn't feel the same. We've all missed, birth of other loved ones. We've had a lot of things we've missed. But the longer that this goes on, the longer we're going to continue to miss those things. And so I know it's difficult, but I think if we all rally together as a community, that we are going to stop it, and we take a stand, and we do the things that we need to do, then we will get through this much quicker. There is a vaccine coming, but the vaccine is not the end-all be-all. So even after people get a vaccine, we are still looking at months of these types of practices that we need. So this is not something that we can just hope is going to be over soon. And so we need to rally together, and we need to make it the norm. We need to make it what we're all doing as a community for each other, so that we can get back to going out and seeing each other and having dinner at restaurants and going out shopping, because this is not very far from over at this point. And we need to do it together, or else we're not going to make any headway at all.
I will, Mayor, I'm just going to say a comment and then end here. I think that I am extremely grateful to each of you and the entire healthcare industry and our scientists for bringing some sort of relief. And I think your words carry so much to us and to the community that I just want for all of us to be healthy and safe. And it's for those reasons I've been wearing my mask since March. I haven't, the most times I'm out, I am wearing the mask. I'm home right now, so that's why I'm not wearing a mask. But I want to say that I am extremely grateful for your ever-ending care and love and health for our community, and know that I support you in any way that you need for the support from our city. So thank you so much.
Thank you.
Councilman Kirchner.
Thank you, Mayor. Well, I don't know if there's much left to be said, but just know that you are valued, and please take that back and let your staff and their families know that as well. Thank you.
All right. Do we have any public comment?
No public comment.
Okay. Well, first, I want to thank Linda Plummer for coordinating this. Called her on a kind of a spur of the moment after a conversation with Mr. Rawson, and so thank you for the efforts you put forth. in getting these individuals to speak to us tonight. It's been said before, you know that we greatly appreciate and acknowledge the hard work that you all do. And if there's anything that the city of Yuba City can do, we would like to try to participate in doing that. We appreciate the transparency. We appreciate the information. We can appreciate the passion as well. It comes through. Know that we will be translating tonight's communication so that those in our community that speak Spanish or Punjabi, sign language, et cetera, we'll coordinate that with you as well, Linda, so you see what that looks like before we distribute it. Just cannot thank you enough for taking time out of your busy schedules to come spend some time with us and present to the citizens of Yuba City. Very much appreciated.
Thank you.
All right. Stay healthy and safe, too. All right. It's a great opportunity to have folks like Rick, Dr. Graham, and Cindy present to us and share their thoughts with the community. Just really appreciate the time they took this evening. And again, we'll be making this available so that others can see it who weren't able to see it tonight.